We take a mandatory 3-minute break. We're coming back to talk about some behavior issues. And I know we've struggled with separation anxiety, and people have dogs that are...
Medical Center. This is Doctor Radio.
Dr. Frank Adams, we're back here in rainy New York City on Sirius XM 81. This is Doctor Radio, and it's our first show of the month. We're live every Tuesday from 6 to 8 a.m. We've made our first show all about animals, all about pets, because of you, the tremendous response we've had when we started talking about pets and health. They really do make us healthier, reducing our stress, and it often is helpful for them as well. But what about when dogs behave badly or cats behave badly? So we always are interested in helping people out there who have these behavioral problems, and we always get a lot of calls about behavioral issues. So we decided to do a segment on what can be done to help your pet who's having a behavioral problem. To do that, we've asked Dr. Andrea Tu to join us. I want to say good morning to Andrea.
Good morning, Dr. Adams. Thanks for having me on the show.
Oh, it's great to have you. I want to tell people out there that Dr. Andrea Tu practices general medicine at Park East Animal Hospital. That's in New York City. She also serves as a board member and veterinary consultant with PAWS New York. And that's an outreach program working to preserve, support, and nurture the human-animal bond in New York City's most vulnerable residents. She's working towards becoming a board-certified veterinary behaviorist, working with someone who's been a guest on our show, Dr. Elise Christensen at Blue Pearl. So it's wonderful to have Dr. Andrea Tu with us to take your calls, your emails, all your questions. I mentioned earlier that my two guys at home have suffered with separation anxiety. I know people are out there who have animals who might be a bit too aggressive, might be jumping up on visitors, might be doing some things that are not desired. So it's a perfect opportunity to talk to an expert. And how do you reach us? Well, you can call us at 1-877-NYU-DOCS, 1-877-698-3627. We've gotten a bunch of emails. So it's early in the morning and you prefer email, that's great. docs@SiriusXM.com. We'll get your emails right on the air. Andrea, what are the types of problems that you see frequently? And I'm wondering about, are they in any way unique to being in a big city like New York, or could they occur anywhere throughout the country or throughout the world?
Well, behavior problems really are expensive. They are the primary reason that dogs are euthanized. And just like in human medicine and human psychiatry, behavior does fall on a spectrum. So you do have the ones that fall into the more normal or, for instance, the more acceptable range and then pushing over into the extreme. Now, being that they are different species that live in our environment, they also exhibit normal behaviors that are just simply annoying or present dangers in a human household. For instance, if your dog is going to bark because of separation anxiety, you are at risk of being affected. So there is the behavior that does fall under the normal spectrum for these animals, but just aren't compatible with our lifestyle. When it comes to specific behaviors, we do actually see a lot of behaviors that are very much particular to New York City. I tell my clients all the time, New York City is just not a normal environment for humans, never mind dogs and cats.
Right.
And so we do see a lot of dogs that display city-related anxieties, especially in a lot of the species that are noise-phobic.
Okay. I want to tell listeners again, we're very fortunate to have Dr. Andrea Tu with us to talk about behavioral issues. Reach us by calling 1-877-NYU-DOCS. That's 1-877-698-3627. Email us at docs@SiriusXM.com. So, Andrea, so there's kind of a certain line that will accept a normal behavior, but if they kind of cross that line, then we need someone like you or Dr. Christensen to help with some of these issues. It's important to start young. Let's say people out there, they have a new puppy. How soon should they start socializing? What are the things people could do that might avoid some of these problems developing?
Well, certainly socialization is critical for puppies. That does start between 7 to 16 weeks of age, and we do want to include a variety of experiences, particularly positive experiences. Now, also being a GP, that does kind of cut into your vaccination protocol. There are vaccines that obviously your puppy needs to be up to date on, and they can be exposed to certain things prior to being complete with the vaccine cycle, but your critical socialization period does start prior to when you will be complete with your vaccines. So one of the things I tell my clients to do all the time is to make sure you take your puppy outside, but in a safe way. For instance, being on the Upper East Side, we have a lot of the little puppies that will fit into your purse. Mm-hmm. So I say, as long as your dog's paw does not touch the ground. Mm-hmm. And the big thing that we're worried about here is parvovirus. If your dog steps on the ground, then goes home and licks their paw, they could potentially become exposed to parvo. Mm-hmm. So what I tell clients is keep your puppy in your purse and just walk them outside, walk them into your local drugstore, have your dog hear the sounds of the city, smell the smells of the city, and really kind of get used to that at an early age. If you expect your dog to be one in which you want others to come up and pet them and say hi, encourage that. Mm-hmm. You know, have treats available and have that scary stranger who potentially would be scary to a dog that is two that has never met a stranger, have them meet it at 7 weeks of age and give it lots of treats and make that a positive experience.
All right. And then once you pass that 16 weeks, these types of classes, are they very important?
Once you pass 16 weeks, you know, it still is important to continue to expose them to new things. Obviously, you may not be able to expose them to everything that they will have to encounter in their lifetime, but if you associate that to a good thing in the future, that's still going to be very important. Now, despite all the socialization and the training that you can attempt, there are going to be some dogs that just are predisposed to have problems, and unfortunately those are the ones that are going to come across Dr. Christensen's nice desk.
Okay. All right, we're talking with Dr. Andrea Tu. Dr. Andrea Tu practices general medicine at the Park East Animal Hospital. That's right here in New York City. She's working towards becoming a board-certified veterinary behaviorist, working with Dr. Elise Christensen, who's been on our show as well. We have a call on the line. Angie is calling us from New York. Good morning, Angie.
Good morning.
Good morning.
How can we help?
I have 3 dogs, a 14-year-old lab, a 12-year-old lab mix, and a 6-month-old Newfie Tier mix. And when I feed the 3 of them, it turns into this huge feeding frenzy, jumping and barking, just kind of out of control. I'm wondering if you have any advice as to how to settle the situation.
Okay, we got 3 animals in here, and one is only 6 months, but a fairly big guy, I think. Any suggestions there?
Well, one of the things that may seem pretty simple, but just initially comes to mind is, do they have to be fed together? I mean, are we able to perhaps separate them out into different rooms? Or if, you know, being in New York City, I know that can be hard, have 2 dogs in one place and then keep the other dog, say, in your bathroom and just have individual meal times.
Right. I do separate the areas, but it's more of the preparing the food. You know, when I'm getting their medications out and dishing out the food, you know, they know what I'm doing.
Right. Of course. Perhaps even adding on the visual barrier aspect of that may help. The other thing that may help, and it's a little difficult with medications involved, and what you may need to do is to medicate your dogs first, but the other thing that may help is to use a different type of feeding mechanism. For instance, if you fed them, dogs don't need to be fed out of a bowl. So if you fed them out of, say, a treat dispensing toy while each of them are in their crate, or in an isolated area, but also giving them a visual barrier, for instance, putting a towel over so they can't see each other, and then making sure that the crates are separated at a distance, that gives them a little more time away. It also prevents the kind of the rush to gobble everything down quickly, because the food is going to be dispensed slowly through the treat dispenser.
Okay.
Yeah. As you can imagine, the puppy that's indicator.
Yes, I can imagine. Angie, it's a great question, a difficult problem, I know, but I think hopefully with that advice, things can get a little quieter and more organized at home. We really appreciate your call. We're with Dr. Andrea Tu, talking about all the behavioral issues that affect pet owners, dogs, cats, small animals. Call us at 1-877-NYU-DOCS, 1-877-698-3627. Email us at docs@SiriusXM.com. And we have what I would call a desperate email that I hope we can help with. This is from Mary. She says, my 4-pound male Yorkie has slowly become very angry. He often bites us. Also, he won't pee if he doesn't want, even though he's held it, let's say, over a long night. And then he'll pee on the furniture. We've tried the usual tricks. Please help. We are considering giving him away. Even though we deeply care for him, we are exhausted. So this is a desperate cry for help, Andrea. What do you think is going on?
Well, this does certainly sound like one that falls into the more extreme spectrum. I think one of the first things that I would remind Mary is that your dog really isn't angry at you. These behaviors really are not an expression of dominance, of spite, or of vengeance. It really does stem from anxiety and from fear. Dogs, when they are scared, they really have two choices. They can either fight or run away. And in the case of a lot of dogs, they are really pushed to that point where they do feel like they need to fight back or to express that they are uncomfortable with the situation. And one of the few tools that dogs have to do that when they're pushed to that point is fighting, growling, snarling. Fighting is really their last resort. Now, in the case of this dog, it does sound like we have some pretty serious anxiety issues. I would probably question what else is going on in the household. The first thing we always do for behavior problems is ask if this is a medical issue, because that does need to be our first rule out. So step one may just be going to your vet and saying, hey, look, I need full blood work and full urine. That includes a CBC, complete blood cell count, chemistry, thyroid panel, and a urinalysis to look for other underlying medical issues that could be driving the change in behavior. Subsequent to that, then I would look into the specifics of what is going on during the behavior themselves. For instance, are we not peeing because all of a sudden we've moved to a much louder area of town, or we now have subway construction in our area, and the last time your dog was outside, they were blasting the street, and now your dog associates being outside to a scary environment. So, you're not going to want to pee out there. And we see a lot of dogs that do that, and they will hold it for a heck of a long time because they're just too scared to go outside. And then you then add to that, well, now are you now noise phobic and you're not able to pee because you're scared of the place that you normally go? That's all going to add to our triggers, to our things that can make us more agitated. And a dog that is more agitated will more likely bite. In this particular case, if we are considering giving up the dog, this may be one that I recommend reaching out to us, to our behavior service, and seeing if you can get a consult on board. It does sound more serious, and I would consider this may be a case that might need to consider medications.
Okay. So, Mary, hopefully there can be some resolution. But as Dr. Tu was saying, I think you really need an expert. You really need a behaviorist to help you, and medication may be necessary. But I think the point that Dr. Tu made, which is that this is not anger, this is not spite, this is anxiety. And hopefully that issue can be addressed. This is Dr. Frank Adams on Sirius XM 81. It's Dr. Radio. It's our show each month, the first Tuesday, where we focus totally on animals, how they help us, and now how we can help them with behavioral issues. We have a wonderful veterinarian with us, Dr. Andrea Tu. So call us at 1-877-NYU-DOCS. And these are not easy problems. These are very difficult problems. Call us at 1-877-698-3627. Email us at docs@SiriusXM.com, and we'll get your email on the air. One issue that we focused or had to deal with at home with the help of Dr. Christensen actually was separation and separation anxiety. And I know a lot of people out there I'm sure, have the same problem. Andrea, talk a little bit in general about this type of a problem. Do all dogs have it? Are there some breeds that are more likely to have this or other behavioral issues that you would want people to know about? What about separation?
Well, separation is certainly a behavior that all dogs have the potential to have. Mm-hmm. I don't know that we've seen any particular breed have a stronger display of this behavior compared to other breeds, but it is one that is fairly common, and it is one that is going to be much more pronounced in New York City because you have neighbors that are going to complain about it. Mm-hmm. So it is one that we do see a lot on our service. Unfortunately, it also is one that we do need to go to medication fairly quickly. Mm-hmm. Separation anxiety is a true panic attack. Mm-hmm. And in the case of the more severe ones, the patients can cause a lot of self-injury. And so we do want to make sure that they don't cause self-trauma in their panic bouts and their attempt to get towards you. What's interesting is that we've actually seen a lot of these dogs try to go higher up. And that means they physically try to climb higher in an attempt to get out.
Right. Right.
And then as far as other behavior trends that we see for other behavior issues, again, all breeds do have the potential. You know, we always say the top breed for dog bites is our golden retrievers and Labradors, and that just simply is because they are the most popular breed out there. Mm-hmm. In the newer breeds, designer breeds, if you will, we are also seeing some new trends. For instance, the golden doodles, the Labradoodles that everybody says is the perfect dog. We're actually seeing a lot of noise sensitivity, and as a result, a lot of anxiety in the breeds. And we are treating a lot more now, whether that is, again, simply because of the popularity of the breed, or whether there is some genetic component to that, and that this is truly something we need to be worried about in this new breed. We can't say for sure.
Okay. This is Dr. Frank Adams with Dr. Andrea Tu. You can reach us with your questions about behavior and your animal at 1-877-NYU-DOCS, 1-877-698-3627. A great opportunity to talk to an expert in this area. You can also email us at docs@siriusxm.com. We only have Dr. Tu for about 6 more minutes. Time just goes so quickly. And here's an email from Sharon in Missouri. It's another somewhat desperate one. She has 2 cats. And in the last year, the older one, who's 12, has started to bully the younger one, who's 9. I've tried everything, including the pheromone plugins, and now the younger one has started growling. Is there anything else I can do? Sometimes they fight, and the older cat came after me when I tried to separate them, and she ended up Sharon had to go to urgent care for treatment. So we've got a real problem here.
Yeah.
Andrea, any suggestions?
Well, you know, the suggestions that we mentioned already earlier, it certainly applies, especially in an older dog. If the instigator, if you will, who's older, suddenly has an acute change in behavior in older dogs, the first thing I always have to worry about is some sort of disease, for instance, some sort of intracranial disease, like a growth in their brain that is causing changes in these behaviors.
Right. There are 2 cats.
Okay.
I'm sure the same question applies. Yeah. Is there a medical reason?
Exactly. And if not, then we do want to consider, first and foremost, speaking to your veterinarian. She mentioned the diffusers, and I believe what she's likely referring to is Feel Away, and those are actually great products. They are pheromones. So they're aerosolized hormones that a very smart company called Siva has made into a synthetic product that you can plug in. They do have a few different products. The one that has traditionally been on the market is called Feel Away, and that is a derivative of the cheek gland pheromones in cats, and that is used to help cats be more calm and be more relaxed and kind of recognize your environment a little better. They recently came out with a new product called it's Multicat. And this product, while it is still a pheromone product, it actually uses a slightly different pheromone derivative that has been shown to help with intercat aggression in particular. So in this case, I would say try to obtain one of the multi-cat phenolated diffusers and see if that helps your situation. They're just on the market, I believe, for about 2 or 3 months. So it may take a little searching to find it, but I have seen it in pet stores in New York, and so certainly worth a try. Other than that,
I'm curious, that the cats apparently lived together fairly, I'm going to guess, peacefully for many years, and now they're fighting. Does that help at all to know that they were well together and now they're not so good together?
It doesn't.
Okay.
There certainly could be. There's certainly a lot of history that we could divulge into to try to figure out if there was an inciting factor. Unfortunately, cats are prone to almost like a post-traumatic stress response. Being much more sensitive than dogs in a lot of ways, they will have this kind of one-time incident that sets things off and that makes things go away. And as a result, the delicate balance in the household is completely shifted. Or, for instance, that the cat is now extremely fearful.
Okay. All right. Well, Sharon, we hope that new product that Dr. Tu mentioned will be available to you and you can try it. If not successful there, then, as we've been saying, consulting with a behaviorist. And Andrea, that was going to be my next question. And unfortunately, we're under 3 minutes with Dr. Andrea Tu. I'm glad that you're developing your expertise in behavioral issues. But there aren't that many board-certified veterinary behaviorists. How do you find them? Is there a website? What's the best way to find this expertise?
Well, the best place to start would be on the American College of Veterinary Behaviorists website. That's www.D as in dog, A as in apple, C as in Charlie, V as in Victor, B as in boy.org. That's where you can find the list of all of the current board-certified veterinary behaviorists in your area. But again, like you mentioned, Dr. Adams, there are very few. I believe we're somewhere around 50 for the whole country right now.
Wow.
We're pretty well distributed, so you're likely to find one somewhat in your area. And I believe there are ones out in Missouri to help out our cat Russian household. But if that doesn't work, if you're not able to get to a veterinary behaviorist, being doctors, we do need to meet you in person and establish that patient-practitioner relationship before we can offer you recommendations directly for your specific case. So if you're not able to get to a veterinary behaviorist, what you can do is have your veterinarian give us a call directly, because while we're not able to give you recommendations over the phone, we are able to give recommendations to our peers and help your veterinarian guide them in the treatment of behaviors. And through your veterinarian's patient-practitioner relationship with you, we can certainly give you recommendations on medications and what to watch for and things like that.
Okay, that's a great suggestion for people out there listening. And Andrea, make sure I'm doing this correctly. The website, DACVB.org.
Yep.
Okay, that's a great place to go.
Yeah.
All right.
And then for our New York City-based veterinarians, certainly don't hesitate to reach out to Dr. Christensen, and I would be glad to help. I know we have a very long waiting list. If your client can't get in and they're desperate, certainly give us a call.
Okay. Dr. Andrea Tu, thank you so much for being with us. I know we're going to have you back because we didn't get to a lot of things, and I'm really hopeful we can do this again. Thank you so much.
Absolutely. It was fun. Thank you for having me.
Dr. Andrea Tu. This is Dr. Frank Adams on Dr. Radio. We have a second hour coming up to talk about